Hello everyone, my name is Jen Nolan and on behalf of Musculoskeletal Australia, I would like to warmly welcome you to our webinar this evening titled Pain Management in Musculoskeletal Conditions. I'd like to begin, however, by acknowledging the traditional custodians of the land from which we are broadcasting this evening, the Boonwurrung people of the Kulin Nation, and pay my respects to their elders, past, present and emerging. On your screens now is our list of free consumer webinars for 2021. If you haven't already registered for the remaining webinars or for the series, you can do so on our website. We will also be running an additional webinar on Wednesday, the 15th of September, titled Making Sense of Disabling Back Pain, which will be our annual Coadlo Community Lecture. You can find more details on our website, although everyone who registered for our whole community webinar series has also automatically been registered for the Coadlo lecture. When you visit our website, you will find an extensive range of information, films and videos, including the recordings of all our past webinars. You can also find information about our other initiatives and services, such as our peer support groups, our MSK Kids program, our MSK newsletter, and our national MSK helpline. I also urge you to read the report of our recent National Musculoskeletal Consumer Survey. The survey report is titled Making the Invisible Visible and details the physical, emotional, financial and social impact of musculoskeletal conditions on people living with these conditions. Our presenter for this evening is Dr. Jacqui Stanford. Jacqui is currently a Director and Principal Psychologist of Empower Rehab, who specialise in providing interdisciplinary pain management, as well as working with clients presenting with a range of psychological presentations. Jacqui provides training and supervision to health professionals and return to work professionals about the management of clients with persistent pain to help facilitate recovery and optimal function. She is a psychology and pain management advisor and consultant to WorkSafe Victoria. She's also a member of the Australian Psychological Society and the Health College, the International Association for the Study of Pain, and the Australian Pain Society. Jacqui was the Australian Psychological Society representative of the Australian National Pain Summit. Without further ado, I'll hand proceedings over to Jacqui. Thanks very much, Jacqui.
Thank you so much, Jen. So pain management is absolutely a passion of mine. It's what I work in, I train in, I supervise people with, because I think one of the big challenges for all of you who experience pain, it impacts your life in so many different ways. And I like the way Jen was talking about the research that talks about the invisibility of pain. A lot of health conditions aren't seen, yet it impacts your life every single day. So what I hope to do tonight in a really short window of time is to provide a quick overview to how we know the pain system works, and then really look at some strategies that might help you be able to take the next step in your journey and how you can live the best life you can with your pain. What I want you to do is, as Jen said, is pop questions in the chat function of what it is you'd like to know more about, what I can clarify as I speak as well. So pain, how does it work? I think for many of us, we have initially had quite a simplistic view of pain. I'm not going to talk about any of your pain now. I'm going to talk about if I cut my foot. If I'm walking across the road, I'm just going to try and work out where to get the light the best way I can. That's definitely better there. If I'm walking across the road and I stand on a piece of glass and cut my foot, I'm going to get pain. And any of us who have little kids will have known that experience. When a kid falls over, we often say, you'll be right, there's no blood, up you get, keep going. Because what we often make an assumption is what we see as the damage, what we see as the physical sign indicates what the pain someone's experiencing is. But we know that's not the case. Because what happens is, if I cut my foot on a piece of glass, that nerve needs to go up my leg, and then it joins to my spinal cord, a different nerve, and goes up to the brain, to lots and lots of different places in the brain. Now the brain then gets that message and it responds, and the brain will send down messages. So if I cut my foot on a piece of glass, that message goes to the brain, and the brain goes, oh, you've cut your foot, ouch, hurt, protect. But if I'm crossing the road, cut my foot on a piece of glass, right as a bus is hurtling towards me, I'm going to be focused on jumping out of the way, and the adrenaline that my body will produce at that time will change how those messages work. If I'm then crossing the road holding my kid's hands as the bus hurtles towards me, it's going to be even more delayed. Because what happens with pain and the way it works is there's messages that come down that decide the bus is more important. The challenge is when we have chronic and persistent pain, the system changes. Because for every one wire that's coming up, there are 200 that go down. 200 messages that can either decrease the pain we experience or 200 messages that increase the pain we experience. And the pain that we experience is in our foot or in our back or in our knee or in our hip. Wherever we experience pain, it's not in our brain. But the brain produces something really important that enables that to happen. Now, if it was a bus hurtling towards me, we know adrenaline is one of the main chemicals. But we don't want to all be in the fight and flight response constantly. What happens more ongoingly is the chemicals that reduce our pain are what we call our endorphins, our feel-good chemicals. These are the chemicals our brain releases when we're feeling pleasure, enjoyment, and achievement. The chemicals, though, that increase the message of pain that comes through are the stress, the cortisol, or the way we like to talk about it is the buckets of petrol. And so when we have an activity that we do or an impact of something that we do, depending on how many buckets of water and how many buckets of petrol we produce at that time will determine the pain we feel. This explains why on one day you might go watch a movie and you can sit throughout it and you're okay. And then the next day you watch a movie and your back's so sore you struggle to get out of the chair. Or you can drive to your daughter's place one day and manage it okay and you struggle the next. And so many people that I say go, my pain has a mind of its own. It varies every single day. No 2 days are the same. And that's because pain is really, really complex. There's lots of factors we need to consider. So with anyone's pain, we always want to address the biological factors as we're best able to. If I cut my foot, I will be putting a Band-Aid on it, making sure there's no glass still in it and protecting it. If I sprain my ankle, I'm going to be resting that ankle for while the first stage of healing occurs. If someone has rheumatoid arthritis, it's taking the advice of health professionals around what to do from a medication perspective. So we want to address the biological factors as we're best able. But as I'm sure all or many of you are aware, that doesn't answer the question. You've done what they've recommended you do and you've still got pain. You've taken the medication and you still struggle. You've had the surgery and you still have pain. No matter what we do with the biological factors, pain is so much more complex than that. And so what we want to do is look at what else we can do. So we want to address the factors that for each of us that are influencing our cortisol, the petrol, the stress chemicals. This stress will include things like worry about the future, disappointment of missing out on something. One of the things I'm finding really interesting and in a lot of ways sad is with the pandemic that's going on now, there's a lot more cortisol and petrol for many people day to day. So it doesn't even need to be the stress related to your health. It can be the stress related to worry about your daughter, how she's going at high school, or your brother who you just found out has cancer. Whatever in our system releases cortisol will sensitize each of our nervous systems. And what that does, when we're more sensitized, it's easier to experience more pain. So we need to address those factors the best we can. We also want to focus on what we can do to increase our achievement and enjoyment. These are the endorphins, the buckets of water. Now, as a psychologist, I was taught many years ago around the benefit with depression of pleasant activity scheduling. We know it. Do something enjoyable. Go out for dinner. Think about many of the things in lockdown that you're not able to do, and you'll probably come up with many of your buckets of water. And we often focus on the pleasure and enjoyment, which are really, really important. But the other part of buckets of water that we don't often think about or acknowledge enough is the achievement. And this can be the achievement even when you don't enjoy the task. So for some of you, you might say, I hate vacuuming. But you might enjoy the achievement of when it's done until someone comes in and spills crumbs on your floor. Or you might not enjoy the tasks of paying bills. I don't enjoy the task of paying bills, but I definitely feel satisfied when I know there's nothing outstanding and it's all sorted. So when we look at buckets of water, it's really important to be looking at what are our enjoyment and what are our achievement, because it's both of those that release the buckets of water that then dampen down the signal that's coming through. And of course, the other thing we need to do is look at our activity levels. So some of you might go, oh, I enjoy gardening. So does that mean you said achievement and enjoyment are really important? Well, I need to weed that whole garden bed and prune all my roses and sweep up the courtyard. So I'm going to do 5 hours. The problem is, if you haven't done that for a long time and you have pain, your body's going to go, hang on, that's too much. You can have too much of a good thing. And so what we want to make sure we're doing is that we're also factoring in how much of an activity we're doing and pace that up. Now, as Jen said, I run a pain management program. I see individuals, I see people with WorkSafe or TSC claims, health conditions, cancer, fibromyalgia, eye pain, facial pain, rectal pain, pelvic pain, pain. Pain is complex. Pain can impact all of us in lots of different ways. And so when we look at what pain management is, one of the really key things is we're wanting to manage the symptoms the best we can while increasing our function. It's not just about waiting till the symptoms go. Early on in a diagnosis, that can be more realistic. Let's wait till my sprained ankle has settled and then I'll get back to playing sport. The problem is when we have chronic or persistent pain, the symptoms don't go. And part of that is because we reduce our function to try and manage the symptoms. What we need to do with pain management is look at how do we manage the symptoms well enough to enable us to do more activity. And as we do more activity, especially if that is achievement, enjoyable, meaningful activity, we release more buckets of water, more endorphins, which in turn turns down what's happening in the pain system. We want to look at function across all domains. One of the things that we see really important in Empower Rehab is we set goals with clients around their personal and domestic. So if someone has trouble with their personal care, dressing themselves, self-care in some way, or their domestic tasks, cooking, cleaning, mowing the lawn, gardening, whatever is important to the person, we always look at something in those domains. We also look at something around social and leisure. That can be different for each person. Each of these goals needs to be unique. And then we look around work, productivity, vocation. Even in retirement, if you go, well, I don't work, I've now retired. But what's your vocation? What's the things that you want to contribute to? Is that looking after grandkids? Is it about volunteering somewhere? Is it about engaging in some different activity? Whatever it is that's important to each person. And the reason we find, and when you work at all 3 different areas at the same time, of course, you get the benefits of feeding into one and then the other. I've had many clients say to me when I set goals with them in each area, I'll say, how satisfied would you feel if in 6 weeks you achieved those 3 goals? I still remember one particular client said to me, I would be amazed, Jacqui, because many times I've achieved one goal, but it comes to the cost of all the other goals. So of course I can get back to doing the housework, but then I'm so wrecked and exhausted I can't socialise. Or I've got back to work, but I was so crabby at home, there was no benefit. So when we look at goals across all 3 domains, we're working out that something is actually sustainable and functional. It is realistic to expect a decrease in pain. So I first started working in pain management 20 years ago, and the message back then was basically pain management is how to live with your pain, how to try and cope with it. Now, that's hard for someone else who doesn't have pain to say to you, you just need to learn to cope with it, live with it. Really? What we know, there's now a national database that looks at pain outcomes from pain management services, and it is very realistic to expect a decrease in pain and an increase in function, no matter what the condition. Interestingly though, when we look at what a decrease in pain, what people expect. So at the end of our programs, we'll often say to people, what's happened to your pain over the last 12 weeks? Oh, it's about the same. Whereas if I said to them, if you look over the last 12 weeks, and even then it's only gone down 1 or 2 because we track outcome measures, 1 or 2 out of 10 at a minimum. When I say how often are you having flare-ups, how intense are they and how long do they last? That is where you can get a significant reduction in pain. Most people then say to me, oh, if I only had 3 out of 10 pain, and I could garden and kick the footy with my kids and go to work and holiday and drive again, I could deal with a 3 out of 10. What I struggled with was the 3 out of 10 fluctuating up to an 8 out of 10, not being able to go out, not being able to socialise. So with pain management, we're always looking at how we balance off the symptoms and increase the function, because it's as we increase function that people start feeling like they've got their life back and things are more manageable. As we have less flare-ups, what that does is it releases that baseline, it reduces that baseline level of pain. Because every time we flare up the system, every time we get those increases in pain, the system gets more sensitised and it's easier to flare up. So pacing. Many of you may have heard the term pacing. One of the things whenever I see a new client who has attended pain management, seen a physio, an OT, ex-phys before, I often say to them, have you heard of pacing? Oh yes, that's where you break up an activity. The challenge is we know that if we just break up an activity into smaller bits without progressing, it doesn't help in the long term. When we talk about pacing, what we actually want to do is work out the starting point. And the baseline, the starting point, is what we can do and manage it at the time and later. Because pain's sneaky. What often happens with pain is we feel good. I'm out in the garden today, the sun was shining, I did my gardening, I felt good. But oh my goodness, when I went to bed, I was so sore. I couldn't cook dinner. The pain was too great. So when we talk about what the baseline is, it's what's an amount of an activity we can do and feel okay at the time and later. Once we've got that baseline, what we want is small and regular increases. And we want this for two reasons. If we make small and regular increases, our pain system can cope with them. So if I can do 15 minutes in the garden and I add 2 minutes at a time, my body adjusts. We very loosely work on the principle of about 10%. Adding 10% at a time. So as you get to greater amounts of an activity, you can often make the steps a bit bigger. So one is the pain system or the pain radar, the pain alarm doesn't switch off if you only make small and regular increases. The other reason is change becomes normal. For many humans, we actually struggle with change and transition. And so if you're changing something every 2 or 3 days, that then becomes normal, so it becomes less scary. Whereas if you go, I'm going to do 15 minutes of gardening for the next 2 weeks, and then I'm going to go 30 minutes, then 45, then an hour, we often get more daunted, more nervous, more concerned. And if you think about it, all of those emotions, daunted, concerned, nervous, they are all buckets of petrol. So we accidentally then create more petrol that makes it harder for us to upgrade and can often increase our pain and get us stuck. As I said before, we want to focus on the function, not just the symptoms. Now, this doesn't mean pushing it through. We will have all probably heard the saying, no pain, no gain. Really important in that statement came around for bodybuilders many years ago, nothing to do with managing musculoskeletal conditions. Pushing through and flaring up the pain system simply makes us more sensitised. So we want to stick to those manageable amounts, focus on the function and increasing the activities that we do. So pain management, if we look at it very simply, which is simple but much, much, much harder to do, is reduce our petrol, increase our water. And that includes looking at what we do with our thoughts. As we manage our activities within that, then we can actually make progress. So, we've got a couple of questions for you. I'd like each of you to comment. The poll's going to come up. I do more of an activity when I feel good and then pay for it. So if we can do that one first, and if people can select this, what they would do, will give us 30 seconds to see what we respond. So how often do you do more of an activity when you're feeling good and then pay for it later and regret it? And for each of you, it might be different activities. It might be driving in the car, might be gardening, might be vacuuming, might be socialising. Doesn't really matter which one. How often do you do an activity when you're feeling good that is more than your body can cope with and then later be more sore or regret it? And really encourage you each to respond to it, because it makes it really helpful to get a sense of, hey, there's lots of us in this situation. It's challenging, it's tempting, I feel good. I didn't do anything yesterday, I was too sore, and now I feel better, I want to get it done. We often talk about it as the boom-bust pattern. And so when we've got most people responded, it'd be great if we could have a look at what the feedback is. So we look at it. Most people are at least doing it occasionally, many doing it regularly and some doing it often. And this is because we want to get stuff done. We're fed up of seeing what needs doing. We enjoy something. The challenge is when we do it, we end up with more pain, which causes more stress. If we go to the second question, would be great. I avoid activities because they cause pain. So for each of you, it may be things that go, oh yeah, I'm too old now, I can't run. So it might not just be, why'd you stop? Was it because you actually just got older, or because the pain increased? How many of you don't get down to your hands and knees and scrub out the bottom cupboard anymore because it hurts? How many of you find that you don't go on long car trips, don't go camping, don't clean out gutters? It doesn't really matter whether it's a smaller activity or a more demanding one. Are there activities that you avoid in your life because they cause pain? And if I had a magic wand, you'd get back to doing them. Now, unfortunately, sorry, I don't have a magic wand, so I can't magically take the pain away to get you back doing them. But it's just reflecting, yeah. I regularly miss out on things that were important to me. I occasionally don't do stuff because it causes pain, or yeah, every day there'd be something I change or alter or avoid because of the pain it causes. All right, if we can have a see, what's the feedback from this one? Yes. And so we've got a few more nevers here, and this may be, hey, I don't avoid the activity because I push through it if it's really worth it. Or it might be at the moment you can do all the things you want to do. For others of you, there's a lot of things. If we look at it, for those of you who avoid activities because of pain, doing my quick maths, 87% of you avoid activities. You avoid functional things that are important to you because you cause you pain. And that's one of the hard things with pain and how it works. It impacts what we're able to do. And if we can then go back to the presentation, thank you. So, what else can we do about it? We've talked about the activities we do, the baseline and pacing it up. I just mentioned before that when we look at our thoughts, there's petrol and water there. So some of you may have heard of cognitive behaviour therapy before. It's a very popular, very strong evidence base in the area of psychology and also in pain management. And basically it looks at what the interaction is between our thoughts, our feelings and behaviour and how they feed into each other. So what I want you to do for a moment is pretend you're me and what I'm going to say to you and have a think about how it would feel. So I'm someone who really enjoys getting out in the garden. I've got osteoarthritis of the knees. I also have fibromyalgia. And so it's a sunny day today. And I look out at the garden and this is what goes through my head. I really need to get out there. I need to prune those roses and look at all the leaves. There's still autumn leaves there. I should have got them done by now. I can't do them though. I'm going to be too sore. I'm going to have to wait till my husband comes home and ask him to do it. I wish it was easier. I'm so sick of not being able to do what I used to be able to do. If I'm like this now, what am I going to be like in another 5 years, 10 years? It just feels too hard. I'm so sick of the pain. Maybe I'll just go out and do a little bit. Even if I just prune those few roses over that side that I can see from the window, at least then I'll feel like I've achieved something. I'm just going to do that because I have to get something done. I can't sit there and look at it all the time. If that is what is going through my head, have a think about how that would feel, the emotions that come. For me, I felt a mix of sadness, frustration, annoyance. I feel a bit defeated. Now, the trouble is, whilst I'm thinking like that, in terms of my behaviour, I'm probably either likely to go out and just do all the gardening to get it done because it's a sunny day and I'm so fed up, or go, oh, it's too hard, I'm not going to do anything anyway. Even if I manage to stick to just doing the pruning of those few rose bushes, if my brain is thinking that, that is releasing the cortisol, that is releasing the petrol, and that will increase the sensitivity and makes it more likely I flare up. So, what do we do about these thoughts? There are 5 common words, and you may then be able to reflect back on them, and I'll give an example again in a moment. There are 5 common words that underpin 95% of our frustration. You'll see on the left-hand side is the unhelpful word, the should, have to, can't, the question mark, the unanswered questions, and the wishful thinking. We know that each of these are unhelpful. The problem with the word should is it communicates an expectation. And the problem is when that expectation isn't met, we end up feeling frustrated, guilty, and angry. I should be able to be better than this. The doctor should have helped me more. I should be able to play my part around the house. I should be able to stay on top of the garden. My kids should help me out more. I should be able to get answers to what's going on with my pain. The problem with those shoulds, those expectations, we end up with the first problem of not having answers. And now we're frustrated on top of that. And as that continues, we can end up angry on top of frustrated, on top of the original problem. What's more helpful with the word should, and one of the things I really want to make sure is clear, is this is not about positive thinking. This is about helpful thinking. What we want to do is change language such as should into I'd prefer. I'd prefer to stay on top of the garden. I would like it if the doctors could give me better answers. I would like it if my kids helped out more without me nagging them 57 times. I would like to not get worse as I get older. As we start to change it into I'd like, I'd prefer, it would be good, what happens is it's I language, we're owning it, and there's more flexibility. What that does is it reduces the frustration and anger somewhat. Not completely, but maybe instead of 20 buckets of petrol in the pain system, you've now got 5. But whilst we stay in the shoulds, the demands, the expectations of things, we know that that increases the cortisol and the petrol and makes it harder. And also makes us more frustrated and irritable, which is not pleasant either. The second one is the have to. I don't believe there's anything in life we have to do apart from be born, which we've all done, and die, which for many of us, I hope it's a long time away, depending on your age. Everything we do, we actually do because we choose. But we don't choose because we want it sometimes, or because we like it. We choose ultimately because of the consequences. So for example, I did 3 loads of washing today. I can promise you, I did not choose to do the washing because I enjoy washing. I chose to do the washing today to get on top of the washing while it was a sunny day and to have it all sorted. Now the problem is, for each of you who said before, sometimes you push through something even though you know it's going to hurt. In that moment, you choose to get the gardening done. You might choose to not tell someone you need to stop in the car on a drive, or you choose to cook the whole dinner because you're so sick of not having lasagna and just having sausages and salad. You'll want to cook something properly. Absolutely, you choose that for some really good reasons. The problem is we still get the flip side. We still get the other side of the consequences, which is the flare-up. In the same way that if I stay up really late tonight, watching movies, talking to my partner, things like that, I would choose that because it's fun, relaxing, enjoyable. I am going to be tired tomorrow because that is the natural consequence that comes from it. So for each of you who experiences pain, we've got to find the balance of choice around what we choose to do that factors in the importance, the meaning of gardening, and factors in the flare-up, and factors in what we need to do with dinner. As we are able to make more choices and look at the consequences, we get back in the driver's seat. Because for each of you with pain, on your bad days, you don't feel like you're in the driver's seat at all. Many people, I used to say to people, are you in the passenger seat of your life and the pain is in the driver's seat? I had one client say, no, I'm in the back seat. Another client said, I'm in the boot. Another client said, I'm holding onto the bumper bar of my life with my fingertips. I've had people say, I'm not even in my car, I'm running behind it. The pain is impacting me, it is controlling my life. And so what we want to do is find ways to get back in the driver's seat. The third one is the can't. Can't do it, can't cope. Can't vacuum, can't garden, can't drive for 2 hours. Now, in reality, there are some true can'ts. I can't fly. I jump off the top of my house, you give me $1 million, I still go splat. That's a true can't. And there are some true can'ts for each of us. We can't go back in time. But often when we say can't is, what we mean is it's actually incredibly difficult or something's really, really hard. But what happens when we say can't is we close our mind to the problem solving and ways around doing things. And so what's more helpful is not to then try and be positive and say, I can do the whole garden. That's not helpful. I find it really difficult to do the gardening without flaring up. So therefore, I'm going to choose to do 15 minutes every day because that's within my limit. It means I chip away at the garden and I don't flare up my pain. So we can turn a can't, some can'ts, we can turn them into it's difficult and then make a choice that suits our goals and also our pain. Question mark, the unanswered question. I wonder how many of you this morning asked, do I like coffee or not? I don't know about you, but I know for me that I was probably at the coffee machine before I even woke up because I love coffee. My morning coffee is at one of my favourite parts of my day. So I don't need to ask myself if I like coffee. I already know the answer. Anytime our brain asks a question, it tells us there's uncertainty. And what uncertainty does is it increases anxiety and operates as petrol. So what we want to do is answer the questions as best we can and focus on what we do know and what we can control. Am I going to be worse in 5 years? What's going to happen? Will this treatment work? Is there any point in trying? What's going to happen if I get all the gardening done today? Instead of getting stuck in those questions, I don't know what I'm going to be like in 5 years. Most times, the best answer is, I don't know. What I do know is I'm going to keep putting my best effort into managing my pain and my function the best I can. How am I going to feel if I garden all day? I don't know. What I do know, though, is last night at 3 hours, I was really sore. Well, how am I going to feel after an hour? I don't know. But I think I've got more chance, so I'm going to focus on using my strategies and doing an hour and seeing how I feel. As we answer the question, as we listen to it and respond, it stops our brain spiraling around, which again in turn reduces the petrol and can reduce the pain. Final one is wishful thinking. There is nothing wrong with wishful thinking. What wishful thinking does is gives us hope, it gives us desire for the future. The problem is with wishful thinking is when that's all that's there. For each of you with a health condition, if you just spent the next 3 months sitting there, I wish I didn't have this, I wish I didn't have this, and that's all you did, we know that wouldn't help. In the same that if I went, I wish I could go overseas right now, I wish I could go overseas right now, I could wish that lots and I can't do that either, or I wish I was a millionaire. The problem with simply wishing is when we wish something, our brain thinks we're putting some effort into it and it's focusing on the discrepancy from where we're at to where we want to be. We often feel more down, flat, hopeless and stuck. What's really important with wishful thinking is to acknowledge the wishes. Of course, you wish your pain had gone away. Of course, you wish there was a cure to whatever health condition each of you have. I wish that for you as well. But if that's already been exhausted and looked at, what we often need is acceptance and or action. If anything is about going back in the past, it needs acceptance because one true can't is going back in time. If something is now and future, it often needs a combination. I accept I've got arthritis. I accept I've got this injury. I accept I've got fibromyalgia. I accept this condition I have and I choose to put X, Y, and Z in place to move forward. As we bring acceptance and action together, it can help us move forward. So, going back to the example I said before, version 1, looking out the garden, sunny day, wish I could do it all, can't, have to, shoulds around it. I'm going to give you the 2 versions and tell me how each of them feel. So the first one, such a sunny day, I need to get out there, the garden's a mess, I wish I could do it all, I should be able to at least do some of it, it's pathetic. I wish the kids would offer to help out more. I have to nag them to get them to do anything. Maybe I'll just go out and do a bit and see how I feel. Too bad if I'm sore. I'm just going to do it anyway. It needs to be done. It has to be done. Compared with, I would like to be able to garden more than I'm able to at the moment. I choose to go out and do a manageable amount today, and I'm going to choose to keep doing a small amount each day to chip away at it. It's not the way I wish it was. I accept it's the way my body can cope with things at the moment, and hopefully by doing this, I can feel a sense of achievement and enjoyment in what I'm able to do. I don't know what the future holds and how much progress I make, but as I choose to get back into the gardening in little bits, I'm going to focus on what I've achieved rather than focus on what I haven't. What you'll notice there, if we change each of those words into the more helpful language, for many people, they'll say to me, oh, the second one feels more empowered, more possible, more hopeful. Now, I didn't say in anything of the second version, this is easy, I can do whatever I want. Of course not, it's not that simple. But as we change the way we think, our emotions are less upset, so we release less petrol. And also in turn, it makes it a lot easier to go out and just prune the roses that we've planned rather than do the roses and then sweep and then dig and then do other things as well. Now I've chosen gardening as an example, but obviously this applies to any behaviour, any activity. So we have another poll. I have noticed thoughts similar to the first example, the shoulds, the have-tos, the can'ts, the unanswered questions, the wishful thinking. So if we can go to this poll, and if people can fill it in again, would be fantastic. Have you had days and moments like that first example where you're just fed up and you know it, and you might even know your thinking's not helpful, but it just seems to take over? For some of you, these might go, oh my goodness, Jacqui, you're reading my mind. That's what I'm like all the time. Some of you might go, yeah, lots of the time. That's common. I've seen it. The one I deliberately haven't put a never there because I have not met a human being who doesn't use those 5 words in some situation. Whenever we're stressed, frustrated, sad, hopeless, disappointed, that language will be there. And people can pop those in, and when we've got a good number of responses back, the shoulds, the have-tos, the can'ts, the unanswered questions, and the wishful thinking. How familiar are those to you? Yep. So people are able to recognise that, hey, this thinking's there. And this is one of the roles that as a psychologist that we often focus on is looking at how our thoughts influence things. Because if you think back to the triangle that was there before, our thoughts, feelings and behaviour are all related. No one just has thoughts that all feed into each other. Thank you. One of the challenges is around it is what else is going on with our emotions and what's influencing how we respond. And then I just double pressed. Because one of the big problems for a lot of people when you have a chronic health condition is grief. Now in our society, we often talk about grief as being bereavement when someone dies. But grief is actually the emotional response we have to any loss. Loss of independence, loss of ability to garden, keeping going with that example, loss of ability to work, loss of kids moving out, loss of dreams for the future, of loss of holidays, any loss we have, the emotional response is grief. And often when we talk about grief in our society, if we think of the first lot of circles, the green circle is us as a person, and we have a big loss. So we have a big blue hole. We often talk about grief over time. As time heals all wounds, it gets easier with time. And that is like implying that the second circle, we are the same size, but the grief gets smaller. One of the problems with that is it starts minimising over time the loss, the things that we're not experiencing anymore, whether it's a person or our independence or an activity. What's more helpful is to think about grief as the third lot. The grief can stay the same. The loss of whatever it is for each of you that has been hard in your journey is the same. What we want to do as people is expand ourselves around it. As we grow, then we bump into the grief less. And so in order, what this actually looks like is we need 2 types of grief. One is the practical grief and one is the emotional grief. The emotional grief is dealing with the blue circle. This is acknowledging the loss, memories, feeling sad, talking about it. With bereavement, it's photo albums, lighting candles, flowers. I remember one client a few years back on her mantelpiece had candles for every family member who had passed away. And when we talked about grief, she actually decided she wanted to light a candle to acknowledge her health, the losses she experienced with her work, her independence, and things like that. And she was improving in what she was able to do, but for her it was really important to symbolically acknowledge that. And that's the blue bit, that's the emotion bit. Now, I'm not recommending to each of you to go get a candle. Some of you might go, that sounds great. Others go, why would you do that? This is where grief and the emotional processing is really subjective. But have a think about it. What is it first of all, what is it you've lost? What is the grief that you're experiencing? What can you do to process the emotions, which is the blue circle? And then what do you need to do to expand around it? So with bereavement, the practical grief might be cleaning out someone's cupboard, the funeral, the practicalities, all of those things. When we're talking about health, the practical component might be finding new hobbies that are within your capacity. It might be finding a new living situation. It might be different things, but it's the practical components of acknowledging the loss. There's no rules on how much of blue grief or green grief or practical grief and emotional grief we need to do. But what we do know is when you can at least acknowledge both components, we can move things through more easily. So, pain is really complex and very individual. Often I like to think about it as a pie, pain management. What is it that each of us need to do? If we just look at this particular example and say for someone's pain, it is influenced by their stress, those common thoughts that I talked about, medication may influence it, the buckets of water, both the achievement and the pleasure, biological factors, hormones, injury, cancer, endometriosis, whatever those biological factors are for each of you, the activity levels you do, and how you're going and progressing what you're able to do. So you might say they're the pieces of the pie. One of the things that's really important is to make sure we're addressing each piece of the pie. If for me, this was my pie, and I'm going, yep, I'm just going to keep working on my stress. If I work on my stress to 100% or 95%, but don't look at pacing up or the activity levels, those two pieces of the pie are going to hold me back. If I just go, I'm going to focus on my common thoughts and change the way I think, but we don't address the biological factors or take the medication we're being recommended, we may get stuck. Or it may go the other way. I do all the biological factors, I see the doctors, I've had all the tests, the scans, the medication, anything they tell me to do. Oh, but this stress thing, I don't stress, I just get on with it. We want to find the pieces of the pie that we're doing the least about and do something about them, because what happens is as we address each piece of the pie, whatever's in our pie, we can actually make more progress. So there's a few links, these slides that go through to some information about how pain works and a couple of good websites around chronic pain. But often one of the questions I get asked is, how do I find good treatment? Whether it's a physio, osteo, psychologist, GP. A few things that can be helpful to ask. Do they know what central sensitization is? So central sensitization is the bit of the fancy word for what I was saying before about how we have the messages that come up from the body parts and the messages coming down from the brain. And we know that if we are overdoing activities with more stress and less endorphins, we end up with more pain. People who understand that will be able to then start finding out more pieces of the pie that can help you. Another thing that I think is really, really important is finding treaters who communicate verbally with other disciplines. Pain is complex. Unless we're working together, we get stuck. And not just a letter, having a conversation, a discussion, to go, how do we help you the best? Where we can, of course, involving you as the client. Setting functional goals, not just symptom goals, not just reduce pain, because that would be lovely, but and do what? And functional goals to me, it's really important they're day-to-day activities, not just I can move my shoulder a little bit higher. So what? Why do I want to? Because I want to hang the washing on the line. Fantastic. Because I want to wash my hair. Fantastic. But that in itself is not meaningful. For each of us, there'll be a reason why we want some of those different movements. So when setting goals, we want functional goals. Treatment with pain needs to teach skills and strategies, not just be focused on symptoms. So have a think. What's your next step? What is it that each of you can do differently so that hopefully the information tonight can translate into your life and make things a bit better for you? And I'm now going to hand over to Jen to facilitate some questions.
Great. Thanks very much, Jacqui. I've heard you present before, but I loved hearing your simple, clear strategies. Well, not simple, because for people experiencing chronic pain, you know, taking some of these steps is not a simple thing, but just very clear, practical things to think about. Things like managing, you know, your expectations, having helpful thinking and helpful language. I think the language message was a really important one. We have got some questions that have come through, so if anyone else has a question to ask, could you please type it in the question box now so that we can finish on time as planned tonight. Jacqui, there's a couple of questions that have come through that, if they're not quite appropriate for you to answer, just sort of say they might be more clinically focused, as in medical. But someone has asked, is there a test to check your cortisol level?
Interestingly, not specifically and immediately, because the problem with cortisol, it's changing in our system all the time. So we often have baseline levels, but from a pain sensitivity, that component fluctuates. So they do blood tests, they can test cortisol, but in terms of the pain sensitivity, it's more the fluctuations that are more useful.
And also, someone has asked about the potential kidney damage from the use of long-term paracetamol. Again, that might be more of a medical question. Do you deal with people who might be thinking or seeing long-term paracetamol as an answer to their pain?
And I would definitely recommend actual medication is reviewed by your doctor, because it depends, there's so many factors that influence it. What I would say around it though is definitely good to get those questions asked. And if you're not happy with the answer, get a second opinion, because of course the stress and worry about, am I taking too much paracetamol, is that damaging my kidneys, can also lead to more cortisol, which can actually increase the symptoms in it. So where any of us have worries and concerns around what's happening, I do recommend second opinions. I do think be careful about third, fourth, sixth opinions, because I think sometimes when we're wanting answers different, we want to hope, we can get stuck in the medical merry-go-round as well. So there's no right answer in how many opinions, but I think it's important to reflect on, when is a second opinion actually helping me and leading me in either reassurance or a different pathway? And when, no matter how much reassurance do I get, do I still say anxious? Then I'd be saying it's not actually a different opinion you need, it's looking at what you can do to manage the anxiety and uncertainty about living with a chronic condition.
And Jacqui, this one is asked whether you use ACT, and this question was posed early on in your presentation, so maybe the presentation has answered some of this for the person, but acceptance is difficult for me to grasp. As with chronic pain, I don't want to give up hope of one day not having chronic migraine.
Oh, it's a beautiful question. You have just pinned the conversation I have with so many people. So ACT therapy, ACT therapy is acceptance and commitment therapy. It has wonderful tools in it. My philosophy is I tend to start with CBT, cognitive behaviour therapy, because my philosophy is change what you can and then accept what you can't. I think one of the problems with the word acceptance is we don't have a good understanding of what it means. Acceptance does not mean resignation. Acceptance does not mean I'm not going to keep trying. Acceptance does not mean giving up hope. Acceptance can mean I accept that I have chronic migraines right now, and not but, and I am going to keep looking for opportunities or manage things the best I can. Because I think it's absolutely critical that we maintain hope. We look at what's happening in the pain world since I've been studying the last 20 years, and of course before then, and hopefully in the future that things are improving. So acceptance definitely does not mean giving up hope. It's how we hold acceptance that this is what is now and what can I do about it.
And another person, Jacqui, has talked about even sort of waking up with painful toes from even the weight of the bedclothes. What do you say to that?
So where there is a high amount of pain for something of a really low level like bed clothing, we go, pre having that pain, you would have gone, really? Bedclothes don't cause pain, it's warm and snuggly or whatever. What that is allodynia, and that is where the pain system is so sensitised, the smallest amount causes pain, something that most people might not even notice as touch. That is where that central sensitization system is on super drive. What can happen is if you're using the strategies, that can be desensitized. But I would say if bed clothing at that level of sensitivity, I'd be recommending multidisciplinary pain management. Now, the challenge is multidisciplinary pain management, like anything, is not the same everywhere. Some places are really good at addressing the subtleties. If you feel like you've already done pain management before around it and stuck, I would still encourage you to get second opinions around that and say, this is what I've done in pain management, anything else you can offer? Because we see a lot of people in our clinic who have done pain management before, and when that happens, we approach it differently. We don't go through the basics 101 again. We go, what bit didn't work? What's the little gap? How do we integrate it? And one of the things that we do is we'll often have the physiotherapist and the psychologist in the same room at the same time to try and address some of the real specifics. Or I'll sit in with one of our pain specialists to try and get the bit between the disciplines so we don't end up in silos. So that sensitivity is unfortunately common and incredibly painful and difficult to manage. It can be changed though.
Well, that's a positive message. Jacqui, if your aim is to reduce reliance on medication, is pushing through still a bad strategy?
Yep. Pushing through doesn't work. I wish it did. Get stuff done, you pay for it. It's more about if someone comes to our clinic and wants to reduce their medication, we would, unless they are at unhealthy amounts of medication, we would generally recommend not doing that first. If it's a safe dose, let's focus on increasing your function and stopping those fluctuations in pain. Because if we can get people doing more buckets of water, you've got the buckets of water operate, they're pain medicine. They're the body's natural pain medicine. And so what we talk to our clients a lot about is, how do you have your dose of your natural pain medicine? Oh, it's laughing with my son. Oh, my natural pain medicine is a hot shower. My natural pain medicine is smelling the flowers. Because anything that activates the water is actually operating on the same system in the body that the opioid pain medication operates on. And the great thing is those things don't have side effects like other medication can do. So we would always, first round of goals where we can, focus on increasing function and reducing the fluctuations in pain. And then it's so much easier to reduce medication when you've got other natural medications. Now, of course, that has to always be done in consultation with a pain specialist or a good GP who understands pain. Whereas I think sometimes what happens is people get fed up on medication. Fair enough. I've never met anyone who loves taking medication and wants to. We can sometimes want to throw it out, and if we do it too quick, we end up in a rebound and we get stuck and we get less confident that we can ever get off it, which makes it harder the next time. So I would always recommend, anytime any one of my clients wants to reduce medication, I'd speak to their GP, I speak to their rheumatologist, their psychiatrist, their pain specialist, anyone who's involved, to go, let's make sure we have a plan that sets someone up for success. But first of all, what can we do to build your resources first?
I'm also happy to say, Jacqui, there's a few thank yous, and another one saying, not a question, just mentioning Jacqui is an excellent presenter, well done. But there is another question, good question here. How can you schedule joy without feeling guilty? Finding difficult to change my mindset.
Oh, I love it, because you've just tapped into one of the common words. Wherever there is guilt, I can tell you, you have a whole bunch of shoulds. I should be, all the productivity has to be done before I should be allowed to relax. I shouldn't relax because I haven't contributed enough. All of the guilt, should is the word that drives it. What I'd encourage you to do is write a list of all your shoulds, then have a go at literally word swapping the should for I'd like or I'd prefer. Then practice reading that second list out aloud. And the reason any reframing we want it out aloud is, in order to say something out aloud, I need to think it, I speak it, and I hear it, and tone. So anything that you want to change the way you think, I would say out aloud ×3. That is 12-fold reinforcement of the new message. Because if you change your, I shouldn't do that nice thing, I should be more productive, into I'd like to do that nice thing, doesn't matter if I'm not productive, and there's no belief in it, it won't work. What works is, hey, of course I'd like to do more around the house. And at the moment I'm not, so I'm choosing to do this pleasant activity, and that's okay. I'd like to do more around the house. And at the moment, I'm going to choose this activity because that's really important for me as well, and that's okay. And as you repeat it with tone as well, that's when the brain goes, ah, bucket of water, less petrol, more manageable.
Great. And Jacqui, can mindfulness help with pain?
Definitely. The problem with mindfulness, so there's 3 ways I always do mindfulness with my clients. Firstly, I do mindfulness of breath. The reason I love the breath is we've always got it with us wherever we are. And mindfulness of breath is just noticing your breath, tuning in. When our brain is chaotic, anxious, overwhelmed by pain, stressed, flared up, we're everywhere else but our breath. So simply 1 minute, don't need to do it for hours, I find can make a big difference. 10 slow breaths tuning in. The second way mindfulness is really important is mindfulness of activities. If you're sore and you're at a family dinner, it can be so easy to get so focused on the pain and miss the laughter of your 10-year-old or your 25-year-old's joke or something like that and miss out on the richness. So mindfully tuning into meaningful activities by using all 5 senses. Or if you're in the garden, what can I smell, see, touch, taste? Get immersed in what you're doing. And then thirdly is mindfulness of pain. And this is the harder one because pain is unpleasant, so our brain jumps in with judgments. So mindfulness of pain, what that would look like, or non-mindfulness of pain would be, oh, my back hurts, it's horrible, I wish I'd go away, if only this is better. Mindfulness of pain would be, oh, I notice the tightness in my back. It's quite sore, it's quite intense in the middle. Isn't that curious? I'm noticing the sensation. So for many of you, it's a real challenge to move to that and often needs more support. But mindfulness is about being in the present moment with what is without judgment rather than that chaotic. So definitely it has some really good uses.
And Jacqui, someone says, what can I do when there is no help in regional areas? I suppose, I suppose part of tonight was to sort of try to provide people with strategies they can use themselves. But if someone is wanting to access professional pain support, I suppose there's a lot happening on Zoom and online these days.
Well, I was about to say, COVID has many downsides, but one good side is we've actually progressed our health services, which I think in the pain area, because it's my passion, I'm quite excited about. As I said, there's a national database that looks at pain outcomes, and what we actually noticed in our clinic last year, our results didn't get worse. So we've gone from face-to-face to online, and our results are the same. And so you can get really good services that way. I think the challenge always is finding good services where it's interdisciplinary and affordable, because of course money also can be prohibitive for some people to get those services. Good pain management though shouldn't be long term. It should be getting, there's my shoulds, oh, I'm using the word should. It would be good if pain management always included teaching you the skills to manage it. So we see some people where we'll do for a short block of intensive, give them the skills. You might live regional and then you go home and work on it for a bit and then come back for the next block. So I would say regional, contact any of the pain services, see if they're offering telehealth, see what the options are, because telehealth has changed that completely.
Yeah, look, thanks very much, Jacqui, for that. Look, there's a couple of other questions, but we're right on 8 p.m, so I'm going to stick to our sort of hard and fast rule of finishing at 8 p.m. So for those people who didn't quite get their questions answered, I'm sorry about that, and I'd suggest that you could always ring our MSK helpline with those questions, and our nurses and trained volunteers could possibly also assist with that information. But look, on that note, Jacqui, you're just a great supporter of MSK. You've done several webinars for us, and they're always fantastic. So thank you once again. Thanks to everyone who's joined this evening. Please remember our webinar on Wednesday, the 15th of September, which will be on back pain specifically with Professor Peter O'Sullivan. So that should be a great webinar to watch apart from the others for the rest of the year. So on that note, good night, Jacqui. Good night, everyone. Fill in the census if you haven't done it, and hopefully we'll see you next time. Good night.